Thank you all. It's great to be here. It's particularly great to be back in Massachusetts. We were in Washington, as you all know, and it was 12 straight days, and that's as long as they've held us in Washington, so I can't tell you how good it felt to get on a plane and come back to the 5th District. But I have to tell you, I left a city in full flower. The cherry trees were up and going, the apple blossoms were out, the daffodils, the tulips, so we know it's coming. I can promise you it's coming. I want to thank you for inviting me to speak to you today. Initially, as I just said, I just returned from a few weeks in Washington, where, as you know, we just passed a bill to bring about many changes to our system of health care. Even though this event was not planned to coordinate with that vote, coincidentally it happens to be Women's History Month, I feel, given the significant importance of the legislation, that we should talk about it here today and give me the chance to answer your questions. Over the course of the last year and a half that we've been debating this bill, I've traveled across the district to hear from as many 5th District residents as possible. During that time, I heard from many seniors and retirees who brought many concerns about this legislation to my attention. So I'd like to take a few minutes to address some of those concerns, and then I'd be happy to answer any questions you might have about this legislation or anything else for that matter. First, I know many seniors are concerned without health care reform might impact their Medicare coverage. This is something I hear over and over again, and I want to directly address this concern. This bill does not cut any Medicare benefits. In fact, it does the opposite. It strengthens the program both financially and in terms of the scope of benefits that it provides. But let me talk a little bit about where this concern is coming from. When private insurance companies first petitioned to join Medicare in the 1980s, they asserted that they could provide more care for less than it cost Medicare to provide its services. This is a common argument whenever there's a discussion around privatizing governmental services. They agreed to be paid 5% less than traditional Medicare rates to provide that service. Today, these same companies, now called Medicare Advantage plans, are paid on average 14% more than it costs to provide care through the traditional Medicare program. These overpayments drain the Medicare Trust Fund, raise premiums for all Medicare enrollees, and cost taxpayers $12 billion a year. Payment rates for private plans that contract with Medicare will no longer reflect these overpayments. That is what is in the bill. However, high-quality plans that improve their enrollees' health will receive an increase in their payment. This money can be used to offer extra benefits or reduce cost sharing. Cost sharing is when you have to pay a copay or a co-insurance. That is what cost sharing is. Seniors will have the guarantee that their premium dollars will pay for care and not pad profit margins. Especially since the bill requires Medicare Advantage plans to spend at least 85% of their revenue on clinical services and activities that improve quality of care. Insurance companies have protested that these reforms will hurt their ability to do business. However, the nonpartisan Congressional Budget Office disputes this, estimating that after 10 years, 9.1 million people will still be enrolled in their Medicare Advantage plans. People often challenge the Congressional Budget Office. They say, how can we trust their numbers? Well, I serve on the Budget Committee, and the chairman of the Congressional Budget Office comes to testify before us with great frequency. And the ranking Republican member, a young man named Paul Ryan, complimented the Congressional Budget Office on the work that it does, because every member of Congress, as we file legislation, as we consider legislation, has to have their legislation pass through the Congressional Budget Office, who can give an estimate on the impact on the federal budget. And so I felt if it's good enough for my Republican colleagues, it's certainly good enough for the American people that we can trust the numbers that the Congressional Budget Office puts forth. The reforms ensure that Medicare beneficiaries' premiums are not artificially inflated to subsidize private insurance companies, and Medicare stays solvent and stable into the future. I've also heard from many seniors who've been unable to afford their prescription medications and who have been forced, as a result, to dip into their Social Security checks and their savings in order to afford these medications. Approximately 6 million seniors, 7,400 of whom live in the 5th District, currently fall into what we call the Medicare donut hole, a gap in which prescription drugs are not covered. This bill ensures those seniors will see that gap in coverage completely closed over time. In fact, seniors who fall into the donut hole this year will see a $250 check in the mail this September to help pay for their drug costs. And healthcare reform eliminates out-of-pocket expenses, including copays and deductibles, for seniors on Medicare who access preventive services like checkups, mammograms, vaccinations, etc. Sometimes those copays, a $10 copay, can be $10 too much. You forego a routine physical, you forego a flu shot, you forego something that you know you should be doing, and it's to your peril because you become ill. It's not good for your own well-being. You end up in the hospital. It costs, not only does it cost you in your good health, it costs the system across the board. So by covering all preventive services, we hope to keep our seniors well, and in the long run also bring down the cost that Medicare is paying out. This means that seniors on Medicare will be able to add preventive services for free. Eventually, all private plans will have to cover preventive services for free as well, no matter where we are in the system, a young child all the way through to adulthood and on into our elder years, which means seniors who are not yet on Medicare will also be able to benefit from this change. Plus, healthcare reform will eliminate the harmful insurance industry practices that end up hurting seniors the most. Right now, private insurers are allowed to get away with charging seniors 5 times more than their younger counterparts when it comes to health insurance premiums. Insurers can charge you more because of your health status. They can refuse to offer coverage because of a pre-existing condition. They can rescind coverage if you go to the doctor too much. Or they can put a cap on how much they will cover in a given year, at which point you then have to pay entirely out of your own pocket. These unfair policies impact seniors disproportionately because seniors tend to be sicker or older, have a more extensive medical history to discriminate against, and use the health system more. Healthcare reform will make these practices illegal. It forces health insurers to play fair. And since we are here today to celebrate Women's History Month, I want to talk a little bit about how older women are impacted by the current system and how healthcare reform will benefit women in particular. Older women disproportionately rely on their spouses for employer-based coverage in comparison to our younger counterparts and in comparison to older men. That is why over 1 million women have lost health insurance due to a spouse's job loss during the current economic downturn. When an older woman loses her health insurance, it is even harder for her to find health insurance in the individual market, where there is little to no regulation. And insurers typically charge women higher premiums than men, so the insurance that she or I will find will almost always be more expensive. Older women, because of a combination of gender rating, that's where we charge women more, often up to 50% more than we charge men, age rating, and discrimination based on health status, face premiums that are roughly 4 times greater than those who have employer-based coverage. Women who are on Medicare, who do have health insurance, are disproportionately low income, have fewer resources, and suffer from more chronic conditions than men. As a result, they pay more in out-of-pocket costs than older men. Therefore, Medicare's ability to provide meaningful and protective health insurance coverage is critical to a senior woman's health and financial security. I've also learned that the typical nursing home resident is an 85-year-old woman who enters a nursing home because she lives alone and has no available caregiver. It is no wonder then that women are also more likely to need long-term care services. In fact, 77% of Medicare beneficiaries living in long-term care facilities are women. And women make up 3/4 of all nursing home residents. And that is why I believe it was so important that that we pass health care reform which provides voluntary long-term insurance to help cover the costs associated with growing older for millions of senior women and men who need it. No one should have to make decisions based on their finances rather than what is best for their health, and that is what healthcare reform does. I felt it was important and timely to focus on healthcare reform today in light of the fact that we just passed this legislation this last week. But there's a lot more I've been working on in Congress that is critically important to seniors and families in our district. For example, I've strongly supported the Consumer Financial Protection Agency that will protect seniors from the abuses we've seen that takes place with banks and others in the financial sector. I also am introducing legislation that will make it easier for seniors receiving supplemental security income to increase their savings so they won't be forced into poverty if they have to go on a disability. And so I'm running out at this time to get into some of the details. I'd love to open it up to your questions. And also, if you need any additional information at any point, be happy to send it to you or find a way to provide it to you. But again, I want to thank you for inviting me. And just to mention also that many of these issues have been so important as we go forward, but since it is Women's History Month, as we were passing the bill on the floor of the House, I happened to be sitting with, just coincidentally, there are about 75 women members of Congress. I say women cannot win if we don't run. Once we decide to run, though, we have to make that great effort to win. And once we win, we have to serve and earn your trust and confidence, which is what I've tried to do with all the many ways in which I reach out to people across this district. But I happened to be sitting with a number of other women who chose to run and were fortunate to win as this bill was passing on the floor of the House. And John Dingell, who has been an advocate for health care reform since he arrived in Congress 50 years ago. He's a member of Congress from Michigan. He's now has very serious back troubles, and he moves with great difficulty, but he was coming up the aisle, and we stopped to congratulate him, knowing how important this effort has been. And he said, I could not have done it without all of you here. And we were like 7 or 8 of us women legislators who happen to be there, who understand how very important this is to the long-term well-being of our children, our grandchildren, and our families. I have to say, as I have been thinking about this, and I imagine the health security that my children will have, who are now adults, their grandchildren will have, all of you in this room will have, as we have strengthened Medicare and put in place tremendously important reforms. I'm proud to have been a part of the effort, but welcome your questions because I know there are a lot of concerns people have, and I'm here really to try to address them. So thank you for that. We can talk about health care or other things as well. It doesn't have to be limited.
I'd like to know, unfortunately now we're just getting more details about the bill. That's why we've come up against our cap. But I'd like to know if there's anything in the bill that caps the insurance carrier, how much they can.
There's going to be a lot of oversight of insurance companies. It wasn't in place. If there is a way of capping the rise in premiums, there will be more oversight. One of the debates that the House of Representatives did not win, we wanted to put in place a rating agency, and that would be an entity that could hold insurance companies accountable as insurance premiums were rising. But there will be much more oversight. For example, if an insurance company, most Americans we get our insurance 3 ways. We either get it through the government, so for example, if you're on Medicare, if you're a veteran, if you're an employee of the military, these are government-run health insurance programs. Then 60% of Americans get their health insurance through their employer. It's called employer-based health insurance. And the real challenge has been, and the challenge for all, is the rising cost of care and the rising cost of premiums. But the other challenge is for those who do not have access to insurance through their employer, who are not eligible for for a government-run insurance plan. And so if you're a small business, if you're a self-employed individual, and you try to go out into the market on your own and purchase insurance, you are just confronted with terribly expensive insurance plans. So there will be something called the exchange created. It's not unlike what we have done here in Massachusetts. In fact, under Mitt Romney, our Republican governor, we put in place a system of reform that essentially is the model for what has been done at the federal level. This plan was actually based on ideas that came out of something called the Heritage Foundation, a very conservative Republican think tank that proposed this mechanism in response to the Clinton efforts to reform health care. So this is a plan very embedded in Republican and more conservative philosophy. So we create the exchanges where a self-employed individual, a small business, can go to purchase insurance. And the exchange will hold those insurance companies very accountable. They'll have to come in and provide a basic plan, to be very transparent in what they cover or don't cover, and answer to their, as premiums increase, the why of it. The other thing that this bill does is put in place a lot of pieces to begin to address the cost of care over time. So for example, by covering preventative care, the goal is to keep Americans healthy. And so across the system, as we go forward immediately in Medicare, where there will be no co-pays and no co-insurance for preventive care, that will be true across the system as we go forward. So if I'm a young woman and need a mammogram, I can go and get that routine mammogram without having to pay. The insurance company has to cover that. That should, in the long run, keep us more healthy as a country and bring down costs. There will be something called electronic record keeping. I don't know if you've ever gone to see a doctor and gone from one doctor to another, and sometimes where they do have electronic record keeping, the blood test that you took at doctor number 1 is already available to doctor number 2 through the use of technology. It's a remarkable way to save money, reduce duplication of tests, and also eliminate error. So this is something else, but it's a tremendous investment we have to make as a nation and preserve privacy at the same time. Be very careful about that. There will also be an effort to gather data so we know what works and give doctors and patients a resource, so the doctor and the patient together. I know when I found my husband was ill, this was in 1984, to find out about what lymphoma was, I had to go to the library. I think I maybe found a little library in Washington, D.C. I think I found like 5 pages around lymphoma. Well, now obviously the internet gives us much greater access to information around illness, but we have no way really to judge the accuracy of it. So this would be a place where everybody could go see what the historical data shows on outcomes. You have a reliable source. You can go to your doctor and talk through what kind of care makes the most sense for you. All of these things over time are seen as bringing down the cost of care and then having an influence on the rising cost of premiums. So it's not just about artificially holding down rate increases. We have to hold down the underlying cost of care. And we do know insurance companies engage in some unfortunate practices, so there is much in this bill to eliminate those, so you cannot be excluded for a pre-existing condition. You cannot be dropped if you get too expensive. There will be a cap on your out-of-pocket expenses in any given year. One of the more immediate reforms, and this would be true if any of you have grandchildren who were born with a problem, children cannot be excluded from coverage because they were born with asthma, or born with epilepsy, or born with some chronic illness that today, without this bill, today insurance companies can refuse to cover that young person. So extraordinary reforms in the insurance industry, at the same time extraordinary investment in addressing the cost of care and helping us deliver more cost-effective care that keeps us well as a nation. We've all heard the numbers that we spend much, much more than many other developed countries, but don't necessarily have better outcomes across this country. Massachusetts, we're quite fortunate. We have access to some of the best teaching hospitals and some of the most cutting-edge research in the country. And when we get ill, we're fortunate to be so close to it. But that is not true across this country, where there's great disparities in the level of care and the kind of care. And we just have to protect what we have, especially here in Massachusetts, but at the same time without healthcare reform, currently we all spend about $1,000 a year on taking care of people across this country who do not have insurance. So there is much in this bill to, as I said, strengthen what we have and protect that which we like at the system. But had we done nothing, much of what we were doing is unsustainable. The rising cost of premiums would have led more and more employers to drop their insurance. The rising cost of care would have really shaken the underpinnings of Medicare, because Medicare is a system in which the federal government is paying for everybody's care. That's the safety net we created, an obligation we feel going forward, but we also have to be mindful of the escalating costs. I serve on the Armed Services Committee, and Secretary of Defense Gates annually comes to testify on the budget for the Defense Department and all the services. And every year he says the one cost that is eating up more and more of the defense budget is the cost of medical care for military personnel. Not for those who are, not because of the grievous wounds of war that many are suffering, but like everybody, just the rising cost of care for military families. So this was something, we had a moment in time where we had an opportunity to address it. We have demonstrated the political will to do it. There's much that's coming out in this coming year, and then it will be fully in place by 2014.
Good morning, Representative Tsongas. My name is Tom Gilroy, live in Chelmsford. As you know, you and your colleagues are going on a victory lap over the passage of this healthcare bill. I'm sure many people here probably join you for it. There are many of us here in the 5th District, the state of Massachusetts, and the country who are very much against this bill. It's very, very, very hard to say. And I'd like to know why you and some of your colleagues can vote against your constituents. I know that there were thousands of calls made to your office, all of your offices. You sent emails, you sent letters, but nobody seemed to listen to us. Can you explain to us how you can represent us and vote against us?
Thank you for your question. Thank you for your question, but I represent a very diverse district, and yes, there are people who have had very strong feelings around this bill. They were very strongly held around those who wanted it to pass, and there were very strong feelings around those who wanted to see it go down to defeat. But on the other hand, as you break down the bill and start to look at some of the component parts, there is much broader support for the component parts. So I think that you would agree we need to reform insurance companies so that they cannot exclude someone for a pre-existing condition. I doubt that anyone in this room would want to see a young grandchild excluded from coverage because she was born through no fault of her own with a particular illness. I doubt that anyone in this country, in this room, would really want to see an insurance company drop you as you're heading into the operating room because suddenly you've become too expensive. So I think that I doubt that there's anyone in this room who would really dispute the fact that we really do need to address the donut hole and close the donut hole so that seniors can have access to all the drugs that they need to stay well as they're aging and in the later years of life. I doubt that anyone in this room really would think we shouldn't invest in preventative care simply so we can make us a healthier nation. So I think as we look at all the component parts, there is much broader support for it. And the other really important part here is that this bill is fully paid for. In the first 10 years, it will save $138 billion over a 20-year period. It will save $1.2 trillion to the federal deficit. And that is money that goes to the bottom line. Again, these numbers are based on the Congressional Budget Office, which I mentioned. Is something that both sides of the aisle look to develop numbers around legislative packages that they are creating. And as I mentioned, our Republican colleague who leads the Budget Committee on the Republican side congratulated the Congressional Budget Office on its fine work. So I believe those numbers are reliable and good and really do demonstrate the extraordinary savings over time to the federal budget.
Thank you to Senior Center and to Chelmsford Crossings for this nice event today. There's one thing about this bill that's troubling me a little bit about the provision of the bill for $16,500 new IRS to enforce penalties against people who may not be able to take it, including incarceration. And that to me smells like almost like tyranny. I'm troubled by that, and I hope you might be able to explain that a little bit. And also, even the controversial way that this law was adopted. How do you think your husband, your late husband, rest in peace, how do you want to handle the controversy and how you might have voted?
Well, I have no doubt that Paul would have supported this bill. When he was a presidential candidate, he advocated for insurance reform. Even back then, we've all known that this is something that we have to deal with. In fact, it's been 100 years in the making. Teddy Roosevelt was the first president who said that we really needed to address the issue of health care in this country. As part of the process, I've conducted many town halls, but also many teletown halls, where I can reach out across the district and talk to people in your homes if you choose to stay on the line. And early on, there was a gentleman from Lawrence who was on the line, and he said, you know, I campaigned on this issue for Harry Truman. He's 85 years old. He said, I campaigned on this issue for Harry Truman. Let's get it done. So it's been a long time in the making. In Congress, we had over 100 hearings on this issue, much testimony received, all of it public hearings in which the public was invited and could participate through the televised hearings. Extraordinary input into this, hours of debate in those committees and on the floor of the House, on the floor of the Senate. As much work has gone into, and public work has gone into this bill as any in the history of this country. So I do feel that the process has been very open, quite transparent, and so as it should be, as it absolutely should be. And I, going forward now, will spend a great amount of time, again, in groups like this, sort of trying to talk through people's concerns, address questions. I'll use technology like a teletown hall again. In fact, I'm having one this week to reach out across the district because it is an invaluable way to reach into people's homes. Congress on Your Corners, where we can talk about it again and again and again and try to dispel the concerns that people have. So I do feel that it has been very open and transparent. In the end, we voted on, the Senate voted on the bill with a supermajority, 60 votes. The House voted a majority rule, voted on the bill, and we passed it. The reconciliation piece is a very small piece of it. It essentially, and then the House again passed the Senate bill. We know what's in that bill with very few adjustments to it. Now, the individual mandate is another issue that you're talking about. That's how, as we have here in Massachusetts, and that was a plan really that came out of a Republican conservative think tank in Washington, to create the individual mandate, which says that everybody has to have insurance unless you can demonstrate a hardship. But in order to do that, we also acknowledge that there are some people who would like to have health insurance who simply cannot afford it. So there are levels of subsidy to help people purchase health insurance. That's the case here in Massachusetts, where the Massachusetts government helps people purchase health insurance. And now at the federal level, this would take place as well. To assist in the purchase, but where you don't qualify for a subsidy, but there's still a hardship, then you can be excused from that coverage. The commissioner of the IRS has disputed the numbers around the numbers of people that the IRS would have to hire, but I do know that I just did my tax returns, and there is one page that, and I received a statement from my insurer that says that I'm covered, and I just had to fill out the months that I was covered, which was fortunately every month, and you just submit it with your tax return. But the commissioner has disputed those numbers, and there's no level, one of those issues out there that people would be subjected to some sort of prison incarceration. There's no truth to that. Let me get over here.
Why are you avoiding
Let me just, I'm trying to get around, I'll come back to you. Let me just go. Well, you'll be next.
Scott Brown election, President Obama said that his main priority is going to be the economy. He hasn't done that. I know you have supported a lot of the Obama policies. Can you please tell us how raising taxes in the middle of a recession does anything to help the economy?
Well, I supported there are actually many tax cuts in this bill to support small businesses in the purchase of health insurance. And because we know that many small businesses would like to offer health insurance to their employees, but find the cost of it daunting, or they do it and in spite of the cost. So therefore, if you're a small business and you have 25 or under employees and you elect to provide health insurance, there are tax credits that will assist you in that, and as you help a small business purchase insurance, then that frees up dollars that can go into hiring more employees. We also did just pass a jobs bill that again encourages small businesses, because we know that 94% of our economy comes from the growth in the small business area. And so we've invested in, put in place various tax incentives to encourage and assist small businesses in additional hiring. There's another issue in the health reform bill that is very job related for women that I think is important to note. The issue of gender rating, which we talked about, where women can be charged up to 4 times more than men, has an impact on the hiring in small businesses. I have a colleague from Colorado who was a small businesswoman who talked about the fact that she added an employee. It happened to be a woman. She got the health insurance premium back, and it was so much more than anything that she'd ever been charged for a man. And this cost then went across her entire small business, where everybody's premiums came up or rose as a result of it. But even worse, she said, was the fact that next time she went to hire somebody, she thought twice, even as a woman, about hiring a woman. So there is an insidious form of discrimination that has been taking place in the workplace for years. And as we eliminate gender rating, it will make it easier and easier for women to compete on a level playing field in the workplace, so that there isn't this sort of, as I said, invisible force that encouraging people not to hire women. So it's a jobs bill in many, many ways, but obviously we have much work to be done. What will happen as health reform goes into place and employers are putting less and less money into paying the cost of health insurance coverage, they'll have more money to invest in research and development, create the ideas of the future that are the platform for growth. They'll have more and more money to put in wages so people have more discretionary income. But there is no denying that we do have to focus on job creation. In spite of we've made tremendous efforts to bring our economy back, but there is work to be done, and I'm committed to doing that. One more question, Jim.
There were so many misstatements in your presentation. I have a copy of a 4-page email from you, and it states all of the items that you just mentioned. But there's a lot of misinformation in there that is not as glorious as it sounds. I sincerely believe that you think that some of those things are very good. I'm not doubting your honesty. But the information that President told us is some of it is totally false. Now, I guess to sum up everything, that even your colleague, your Democratic colleague, said that reading that bill was impossible. One gentleman from Michigan said it would take a week and 2 lawyers to define it. The lawyers speaking time and again said they read it and they still don't know what that is. Every time we turn around, there's something new, like the 19 million college students that are not going to be able to go to a private bank or far alone. There's the new information coming down about the group wanting to put in a value added tax, which is actually destructive to income except for 19%. What I guess to sum it all up, I wish there was some way we could talk, because I'd like to give you the truth someday. But did you read the bill? Now, Nancy Pelosi herself said that when you pass the bill, you will then know what's in it.
Yes.
That was probably the stupidest thing I ever heard.
it's not as long as you think it is because, well, yes, it's complicated, and in some instances, a line or two will refer to other legislation, and that's the piece really that we really work very hard to understand. But when you look at a particular page, and I've had other people come up to me and say that, it's really, 3 or 4 spaces between the lines, words are very spread out. Well, I have read the bill. I feel very strongly that this bill was in the best interest of the American people, that it would put in place important reforms for insurance companies, bring down the cost of care over time. I have to tell you a personal story, and that is, and I think all of us in Washington who works as part of this bill have one. Excuse me, let me finish, please. And that is that my husband, when he found out he was ill in 1983, made a decision to leave the Senate. And as he was leaving the Senate, his real concern was that he now had a pre-existing condition known as lymphoma, one that potentially could have been, and was at the end very costly. He worried about what would happen to him and what the implications would be for our family. He was fortunate that he went to work for a law firm where they had employer-based group health insurance, and so his pre-existing condition did not preclude him from having coverage. As a result, he had access to extraordinary health care. It kept him well for 13 years. It did not bankrupt our family, as it does too often bankrupt families across this country. In fact, it's the leading cause of bankruptcy. Prior to the whole crisis in the housing market, it was the leading cause. So I feel this effort will give access to all Americans to similar kinds of health care.
They don't follow the mandate of this bill.
Yes, we absolutely do. We do. We are going to go into the lead. As a result, Congress gets it. This is a notion people do not understand, but Congress, we have employer-based health insurance. The federal government.
Health insurance.
Yeah, the goal. That's not true. It's going to be subjected to all the same reforms. What I have access to is a choice. A menu of choices that the federal government has negotiated with insurance companies. My choices are exactly the same as somebody who works for the post office. They're exactly the same as someone who works for a federal court. They're exactly the same as anybody who works for the federal government, the IRS, in any capacity. So I go and I have a choice of, actually it was Blue Cross Blue Shield plan, one local plan. Some plans are national, others are reflective of the home state you're from. So I could have the national Blue Cross plan, or I could choose a local plan that I chose not to have. And the federal government pays part of the premium, just as all employers do, and I pay part of the premium. That's an employer-based health insurance plan. That is what 60% of Americans have. Your employer negotiates with insurance companies. They create, they give you those choices. They tell you how much you're going to have to pay, taken out of your paycheck, how much the employer is going to pay. That's essentially what I have. My employer is the federal government. But in this bill, now we will go into the exchange. Rather than having the government negotiate the prices, I will come into the Massachusetts exchange and choose among the various health plans that the connector now provides and decide which one is best for me. And that will be true of all members of Congress, not for federal employees in general, not for the post office, the fellow who works or the woman who works at the post office, but for members of Congress, we will now go into the exchange and elect the insurance coverage that makes the most sense for us, each of us individually and our families. Thank you.
And I have the option to go into that same exchange and get the same prices that you have to pay?
The exchange will negotiate the prices. The exchange will negotiate with each insurance company, and if you go into that exchange, you and I will be choosing from the same pieces of it. But again, if you have employer-based health insurance, that at this point, that is as it is, and your choices really are restricted to the ones your employer offers you. That is the system that most Americans have been very happy with and have felt so strongly about protecting as we have done this insurance reform effort.
Nikki, I was on a conference
No,
call.
I wasn't. I think they have
I was on a conference call with you, and, for about an hour, and you had a lot of people asking questions. Your staff took a survey on that conference call, and I kept statistics. 97% of the people said they had a good medical plan. But they didn't answer change. Why are you trying to change a system for 3% of the country that's already getting free medical care? I don't understand what the whole process is about.
You still will have that insurance. If you have an employer-based insurance, you will still have it. This does not change it. If you have tri-car or veterans, it will not change it.
That's not true.
Well, this is a disagreement that.
That's Obama talk.
You have a choice in November, folks. You have a choice in November. It's just too bad.
Thank you, Rob.
Being a retired corporate finance CPA, I look at this as going to a restaurant and seeing all the good things that I can have. I don't see the bill. You know, that's what we are not talking about this. One other thing regarding the finances, you know, all agree that Medicare is going bankrupt and is running out of funds. And yet you're financing this $13 program with $300 or $400 billion in savings from Medicare. Wouldn't a responsible person use those savings, if they're real, and I doubt if they're real, to support Medicare, which I'm on right now, and also isn't the reductions along the same line that you're thinking in Medicare, those same reductions in fees to the doctors and hospitals that the same Congress has vetoed the last 2 or 3 years? Isn't that the same reduction to do? There's a bill that was passed several years ago to reduce payments to doctors and hospitals by 10 to 20% a year. And the Congress has continually vetoed those reductions. Yet your projection of savings is assuming that that's continued. That's why your savings in your budget reductions is false. There's no CPA that would ever sign on those projections. They would go to
Well, the Medicare Advantage savings are real. They've been recommended by an independent entity called MedPAC that looks at ways in which there is wasteful spending within the Medicare system. They have recommended that we scale back on the payments to private insurance companies. We have embraced that recommendation, and we are now shifting those funds to help support the subsidized purchase of health care for those who are up to the 400% of poverty. One other important, and this will be the last question as I have to go, and I thank you all very much. One other important insurance reform in here is that if you have children who are college-age children in your families, if you have grandchildren who are coming out of college and heading into the workplace, they will be able to stay on their parents' insurance plan up until the time they're 26. Tremendous reforms, a great benefit. We'll continue this discussion. We have lots that we need to talk about. I'm happy to do it, but I thank you for your attention today. It's my pleasure.